A very good evening to one and all. Welcome back to the today's session of the Homeo Vision 2050 and AIHSAYA Youth Festival 2K26 organized by All India Homoeopathy Students and Youth Association. Over to you, Aditi.
Hello. Hello and welcome. Good evening, everyone. It's me, Dr. Aditi Malikani, BHMS PG scholar from Srimati K.B. Abbad Homeopathic Medical College, Chandwad, Maharashtra. Actually, in the beginning of the session, I would like to thank and give my regards to Dr. Jaiswal, BHMS Homeopathy PhD scholar, National General Secretary, AIHSAYA. Also, I would like to thank the Organizing Secretary, Professor Dr. Aparna Sandeep Patil, Professor and HOD Department of Repertory, Srimati K.B. Abbad Homeopathic Medical College, Chandwad, Nashik, Maharashtra. Here, I would like to welcome all the attendees for the next fabulous webinar on the topic Examination of Patients and Importance of Investigations in View of Homeopathy by a renowned professor, Dr. Praveen Jaiswal, Professor Department of Practice of Medicine. He is PhD from Department and Government Homeopathic Medical College and Hospital, Bhopal. I would like Dr. Praveen Jaiswal sir to continue with same.
Dr. Praveen sir, over to you, sir. Kindly unmute yourself and have your session, sir. Yes, sir.
अरे शायद रख नहीं चाहिए जल्दी का मतलब ऑनलाइन में
Good evening, everyone. Session is yours, sir.
Good evening, everyone. Am I audible?
Yes, sir.
Now, it is happy to see you all here, and I would like to thank, first of all, I would like to thank to all organizing committee members, Dr. Lavanya madam, Dr. Aparna Parik madam, and Dr. Aditi and all the team members, those who are presenting here, and all the audience, those who are online connected to this network. And now I would like to start my session on this topic. My topic is, as you all know, my topic is examination of patient. I think screen is visible now. Slide is visible.
Sir, screen is not visible, sir.
Today my topic is examination of patient. Slide is not visible.
No, sir. Even the screen sharing is also not visible, sir.
It is continue. It is not having any problem on my side. Now it is visible. Hello.
No, sir. Actually, kindly share the screen, sir.
Audible or good evening, everyone. I am audible now.
Yes, sir. You are audible, sir. Please continue, sir.
Hello. Hello.
Dr. Praveen, sir, you are audible, sir. Please
Yes.
continue the session, sir.
Okay.
Yes, sir.
Okay. Good evening, everyone. Today we are discussing examination of patient and importance of investigation in view of homeopathy. Is- First of all, I would like to say thank you all to wait because of some technical issues, and very sorry for delayed because of this issue. Now I'm starting my session. Now my topic is examination of patient and importance of investigation in view of homeopathy. As you all know that homeopaths need to examine the patients. This is the very important issue which is to be addressed by each and every physician. But nowadays, you can think that no, so many physicians are not focusing on these things. And as our patients are coming in our OPD, or we can say in our IPD, at that time, at that moment, what we have to examine, that first we have to examine the patient. First, we have to decide the condition of the patient, whether it is acute condition of the patient or it is chronic condition of the patient or whatever it may be. That is the, we can say, what is the prognosis and how is the prognosis of the patient, whether it is treatable by our system of treatment, means by homeopathy or not. On those things today we are going to focus, and I would like to concentrate on those points which we need to examine. So in that condition, first we have to examine the patient in general physical examination. This is to be done by the physician, that it starts from the entering or when the patient is coming to you in the vision. From that level, that is derangements, manifestation and body himself, patient, what in the condition patient is coming to you, that is to be observed by the patient, that is to be observed by the physician. And again, it is a duty of physician to pick up and to decide the course of action of disease or what type of treatment he or she may require. The points to be observed in general physical examination, what is to be observed, that is the general condition of the patient, that we all know all these points what we are discussing, but we are not focusing on the basis of our examination points. We are just focusing how is the patient appearing, what are the particular symptoms, and we can say what are the PQRS, physical particular rare symptoms. On the basis of those we are prescribing the homeopathic medicine. But I would like to focus you all that we should prescribe the medicine on the basis of all those things which is physically examined, which is physically present in the patient, that has to be examined by us. That is general examination, decubitus of the patient, build, weight and height, pelorness, icterus, cyanosis, edema, lymphadenopathy, that is to be examined by us, and cupping of nails. These are the things which to be observed. Now, the next is vital signs of the patient, that we all are knowing it, but many of the physicians, many of the homeopaths are not focusing on these things. That is pulse rate of the patient, that may be high, that may be low, that may patient have arrhythmias or any kind of abnormality that may be detected. That is to be observed by the pulse feeling. When you are feeling the pulse, or when you are feeling the examining the pulse, then only you are able to assess the pulse rate is what, and what is the pulse rhythm, and how it is appearing in the patient. That maybe you can say bradycardia, tachycardia, arrhythmia, whatever it may be. In the same way, next point is that blood pressure. Everyone is saying blood pressure, then most of the persons are not observing the blood pressure. They are only thinking, or they are only observing the patient, and they are assessing blood pressure is normal or blood pressure is okay, but it is not there. That maybe happened, that it is to be observed, examined by a patient, physician himself. And again, the next point is the respiratory rate. In the same way, as we have discussed that pulse rate and blood pressure, in the same way we have to examine respiratory rate of the patient, and how patient is taking the breathing, what type of breathing is present in the patient. That is to be again important. in the patient. That patient is taking the labored breathing, normal breathing, or vesicular breathing, tachypnea, whatever it may be present in the patient, that has to be observed by us. Again, the next point is temperature. But if you are taking the pulse or touching the patient, then only it is to be observed that patient may have blood temperature high or low. That is confirmed by the thermometer. Again, the next point is SpO2, which is not commonly examined by the every physician. It is only observed by the modern medicine physician, but it is to be need to be observed that we should examine the patient. Next is the examination of patient that can be performed according to the requirement in the case. Means that is to be depending upon the patient complaints. That is to be depending upon the patient systemic illness and whatever it may be present in the systemic finding. Whether the patient mentioning discomfort pointing towards the system, whatever it may be examining by the patient, that is to be observed, and according to that finding, physicians to be decide what type of investigation and what type of differential diagnosis may be present, and on the basis of that investigation and differential diagnosis, patients should physicians should advise the patients to go through for investigation. Then next is why is it important to diagnose for homeopaths? As you all know, the patient presenting with the moderate to severe abdominal pain, walking, lying down, straight, whatever it may be, bending double, that is associated with the vomiting, that depends upon the patient condition, or that depends upon the patient overall presentation. On the basis of all those symptoms, we are able to diagnose the patient's condition and patient next line of treatment. For example, without examining, if you are saying without examination of patient, we are not able to advise investigation. But homeopaths may prescribe the many medicines without any examination. If a person who is having abdominal pain, they are prescribing so many medicines. For example, colocin, megfast, netramfast, elos, whatever it may be. That is, many times it may work, many times it may not work. So it is my suggestion to please do examine the patients. If we examine the patient, that give us to clue to diagnose the patient or differential diagnosis of the patient, and on the basis of that investigation and differential diagnosis, we are able to confirm the diagnosis. In the same way, examination points towards acute appendicitis, or we can say if patient is having acute abdominal pain, in those conditions we have to go through for particular examination for abdominal alimentary system, and further go for investigation that may be USG abdomen, and so other many investigation. So all those things which are helpful in the diagnosing the patient. In the same way, next we are going to examine the patient in alimentary system. That is to be done by any kind of GI done by the physician, which is indicating any kind of GI disturbances, or especially in acute abdominal pain, that may be, we can say, we all knowing it but we are not performing it. That's why I'm focusing on these things, that is inspection, palpation, percussion, and auscultation. All you know the inspection, so many times it is normal, but again we have to examine this patient in inspection what kind of abnormality is present in the patient. That may be so many types of abnormality, that may be pulsation, herniation, hernial sites, lump, veins, prominently veins are present, peristaltic movement, that may be seen, that may not be seen, but we have to go for examination. Again, in the same way, for the next step of examination, that is palpation, to detect any kind of tenderness, guarding, rigidity, organomegaly, or any kind of lump, fluid thrill, whatever it may be present in the patient, that is to be confirmed by the physician. Again, I am saying in the next step of this examination, that is percussion. Again, on the basis of inspection and palpation finding, you have to go for percussion. And on the basis of percussion finding, you have to go for auscultation, that is bowel auscultation. In the same way, next system of examination is cardiovascular system. If you are going to examine the patient inspection, palpation, percussion, auscultation, then it is able to visible apex beat, or any other pulsation like jugular venous pressure, epigastrium, etc. In the same way, palpation that maybe detects shifting of apex beat, thrill, heaves, tenderness, that all those things which is to be observed by the physician himself. And on the basis of these findings, we are able to make the differential diagnosis, that is on the basis of our examination finding. Next step of examination is percussion to determine the cardiac boundaries. Then the auscultation of all four areas that may be vary from another side that depends upon the variation or cardiomegaly. Commonly S1, S2 is predict, S1, S2 is audible, and to detect S3 and S4 sound or murmur or opening snaps, that you have to be very focused on auscultation, then only you are able to assess it. The next system of examination is respiratory system, that is inspection. Again, I am saying all four steps of this system: inspection, palpation, percussion, auscultation. If you are properly performing it, then that is to be observed by symmetry of chest wall, symmetrical movement of chest wall, bilateral movement, that is should be symmetrical in the chest, expansion of chest wall, and pulsation which is visible at the time of inspection. Again, in the same steps, that is next step is palpation, that is tenderness, apex beat or vocal premitus, that is to be examined by the physician himself on the basis of patient finding. Then next is percussion. If you are able to get any kind of abnormality in respiratory system in tenderness and apex beat or vocal premitus, that has to be confirmed by the percussion. That is to be checked, or any change in the finding or any kind of pathological changes in the lungs tissue or lung sound, which is to be observed by the percussion, that is to be confirmed by the auscultation. That is to be detected if you are properly auscultating in by your stethoscope, that is you are able to hear, that is abnormal breathing sounds like wheezing, pine crackers, and coarse cracks. The next step of examination is nervous system. That is nervous system. If you are able to see or observe the gait of the patient, consciousness, orientation, and behavior, on the basis of so many things, we are able to examine or observe in the patient that how he is behaving. That is cranial examination. That is to be done according to the all 12 nerves, which all knowing it, but no one is concentrating or focusing on these nerves. That is olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, auditory, glossopharyngeal, vagus, accessory, and hypoglossal. All these, which you all knowing it, that olfactory is for. Am I audible? Hello, hello.
Yes, sir, you are audible, sir.
No, I am not able to hear anyone, so that I'm thinking that I
No,
am
you
not
are
getting
audible.
on.
You are audible, sir.
Okay, thank you. Uh, so when you are examining the patient on the basis of in nervous system, on the basis of all these nerves, we are to confirm the functions of all nerves. We all knowing it, but we are not practically, or we can say clinically, verifying these nerves. So it is my suggestion to you all that if you are able to examine the patient in all those points, then we are able to make a proper diagnosis and make the proper confirmatory investigation. The next is nutrition, that is motor nerve system. If you are able to assess the patient nutrition, muscle power, muscle tone, and muscle coordination, and abnormal movement of muscles, or we can say abnormal movement of the patient, on the basis of this, we are able to assess whether the patient is normally moving or normally functioning or not. On basis of patient's movement and physical activity, we are able to assess or confirm these things. In the same way, when we are going to examine the next step of examination, this is fine touch, coarse touch. All these things we are observing, but we are not focusing, or we can say we are not concentrating on these things, that which type of abnormality in patient is present. That fine touch, everyone is knowing fine touch, but anybody can tell me what is fine touch or what is coarse touch? Excuse me, am I audible?
Yes, sir.
So when we are touching the patient by a sharp, or we can say very fine thing, just like a thread, that is fine touch. When we are able to apply the any kind of pressure or finger, that is coarse touch. And we are applying any pressure by your palms and hands, that is pressure touch. That is to be observed, that is to be felt by the patient. If a patient is properly feeling, that is normal functioning. If it is not properly felt by the patient, that is abnormal functioning. Again, that is tactile localization. All these things we are able to ask the question. Tactile localization, we can ask the patient, अभी आप कहाँ हैं, क्या कर रहे हो, अभी कितना बजा है. All these questions may be asked by the patient, and when patient is giving the answer, it is correct, then you can able to differentiate the patient is normally behaving or not. Again, pain, what kind of pain he is having and how much the intensity of pain. Again, the temperature, vibration, sense of joints position, recognition of size, shape, weight, all these things to be observed by the patient, and that is to be confirmed by you, that patient is observing it normal or not any abnormality. If any kind of abnormality you are observing, that is to be mentioned in your finding or observation. Again, these reflexes, what we are able to say, that is conjunctival reflex, corneal reflex, pupillar reflex, plantar reflex, biceps reflex. These all reflexes are present in the patient, but we are not able to going to examine this because we are saying it is normal. But if you are seeing any kind of patient who is having any kind of you can say conjunctival deformity or any kind of eye disease or any kind of severe patient, or you can say patient those who are having cerebrovascular accident or paralysis or paraplegia due to cerebral hemorrhage or any spinal injury. In that condition, you should examine all these things. Conjunctival findings that may be related to some head injury or poisoning or pupillar reaction. Again, corneal reflex is again with the light. You can observe pupillar reaction again with the touch, fine touch, or pupillar reaction by the light. That is to be observed. Plantar, you can examine by the knee and knee hammer, and again biceps jerk and triceps jerk to supinator jerk, knee jerk, ankle jerk. I think you have all known this, but you are not applied it properly. So if you are applying it properly, then you are able to differentiate it which kind of abnormality is present in your patient and which kind of abnormality is not present. That gives you help to make the proper differential diagnosis. Now I'm coming to our point. What we should homeopaths advise investigations. Commonly, we are examining the patient, but we are not advising the investigation, and that is to be commonly we have to advise to the patient what to do and what not to do. If we are properly advising the investigation, it is the advancement, or you can say this is the advantage of our science, that you are able to assess the proper disease diagnosis, proper disease prognosis, and proper investigation also. If you are advising the proper investigation, that will give you a final diagnosis, and that on the basis of that final diagnosis, you can able to decide the prognosis of the patient. Again, the case taking and examination points towards more questions that arise by the physician mind, which may be ordering or concerned investigation according to the finding. Commonly, we are going to examine only CBP, but CBP only does not mean only complete blood picture. That gives you so many things, that what is the count of hemoglobin, percentage of hemoglobin, what is the count of RBC, what is the count of WBC, what is the count of eosinophils, what is the count of monocytes, neutrophils, etc. So all these things give you the clue for making the differential diagnosis. Investigation help in ruling out many disease, that you can say it is important to make a proper diagnosis can be given by the investigation. Routine investigation, we all are knowing it, but we are not able to differentiate it whether it is normal, it is abnormal. So it is my request to all you that you should take proper guideline about investigation and follow the investigation, and on the basis of proper investigation and proper normal values, if you are correlating with this, then you are able to assess the proper differential diagnosis, and you are able to make the final diagnosis and proper prognosis of the patient. That will give you so many kind of help in your routine practice. That is, investigations are, you all are knowing it: CBP, liver function test, kidney function test, lipid profile, fasting blood sugar, postprandial blood sugar, thyroid profile, ECG, serum electrolytes, and in females you can say mammography, pap smear, HbA1c, serum calcium, serum vitamin D3, and in males specifically for PSA, for prostate specific antigen. Those are patients, those who are having urinary trouble, are in old age patient, ECG, TMT, and HbA1c. These are the common routine investigation which should be advised to the patient which is more than 40 years of age. And special investigation, if you are going to through for this, that is abnormal routine test, that is clinical condition of the patient requires, according to the complaint, that may be x-ray of particular site, you can say x-ray of chest. Commonly we are saying x-ray chest is only for chest abnormality, but there gives you so many clues: chest abnormality, cardiac size, any kind of ribs abnormality, any kind of pathology which is to which are going to develop in the chest, that may be tuberculosis, respiratory infection, and so many other things which is not observed by us, that is to be focused in your investigation. And again, in the ultrasonography, if you are going to examine, for example, a patient who is present you in front of you for abdominal pain, and you are thinking it is renal stone, but if you are going through investigation, and it may be happen that you are not your patient is not having renal stone, in that condition you have to go through for next line of investigation: what kind of pain is this. And if you are going to again CT scan, that may be, it may be happen that patient may have some pancreatitis or any other kind of abnormality, that may be appendicitis. That depends upon the patient's symptoms and finding. So it is my advice to please concentrate on these things. In the same way, next investigation is MRI or TTE, transthoracic echocardiography. So, so all these investigation will give you help for making the diagnosis. Next line of invasive investigation, that is to be give the help. So these investigation, if you are not able to advise the patient, or you are not able to perform the patient, but you should advise the patient go for higher center and take these investigation, and on the basis of these investigation you are able to decide that patient is the patient diagnosis and prognosis is good or not. Like angiography, TEE, transesophageal echocardiography, and biopsy, FNSE, histopathological examination, followed by histopathological examination, endoscopy, colonoscopy, lumbar puncture test for CSF analysis, bronchoalveolar lavage, and thoracocentesis. All these investigation is for it. You can say these are invasive investigation, which is to be performed by a special specialist specifically. The next line of investigation, that may be abdominal X-ray, is for particularly AP view. Commonly, it is performed by PA view, barium meal X-ray, mammography, ultrasonography, ERCP, upper GI endoscopy, lower GI endoscopy, and stool culture. All these investigations will give you a clue. If you are going for respiratory system examination, that is X-ray chest, PA view, AP view, and lateral view. If you are properly knowing it, what is the indication of PA view, what is the indication of AP view, that will give you the clue when it is required PA view, when it is required AP view, when it is required like lateral view. Then only you are to differentiate it, that patient is having pneumothorax or pneumonia or chest deformity, or you can say any kind of rib fracture, whatever it may be, that decided by only investigation, that is a proper view of X-ray. Again, the next is HRCT. If you are not having proper facility of HRCT, if you are having a good quality of X-ray, you are able to differentiate it. Then next is pulmonary function test. If your patient is having dyspnea, then you have to perform this investigation, and on the basis of this investigation, you can go through for the next line of treatment. Then again, arterial blood examination. Although it is very important, it is not performed by us, but you can advise the patient, those who are having severe dyspnea, or you can ask the patient go through for an investigation, and you can advise the patient to go for hospitalization, and on the basis of this, you can make the diagnosis that patient is having which type of dyspnea, that may be metabolic acidosis, or that may be breathing problem, or whatever it may be, that is to be decided by arterial blood gas examination. Then again is bronchoalveolar lavage. If patient is having obstruction in bronchus, or any kind of plug which may be obstruct in the bronchus or alveoli, that may be clear by this investigation, bronchoalveolar lavage. Then again is thoracocentesis, which is to be observed by a proper specific special specialist, that will be performed by the thoracocentesis. Next line of investigation is specifically for cardiac disease or serious examination, that is ECG, TMT, Holter monitoring, cardiac markers, troponin T, troponin I, CKMB, that is creatine kinase, and myoglobin, BNP, beta natriuretic peptide, echocardiography, cardiac catheterization, CT angio. All these investigations performed by the cardiologist only, cardiothoracic surgeon. So it is to be advised to your patient, if he is having that kind of disease, then you have to ask the patient go through this and get the report, and then you have to decide whether it is treatable by homeopathy or not. Most of the times we are able to treat, but we are not knowing it, that we are able to treat this. For that, you have to know the proper knowledge of these investigations, which is to be required at what time, and what is the scope of our system, means homeopathy, in these kind of diseases. Then next is nervous system examination, that is EEG, MRI brain, NCCT, non-contrast CT scan, and contrast CT scan, and then again is CSF analysis. On the basis of these investigations, we are able to assess the patient, which kind of disease or diagnosis in the patient is that. So for these type of investigation, we have to ask the patient go for a special center and get the investigated. Thank you.
Yes,
Hello.
Dr. Lavanya Sai.
Thank you, sir. Thank you so much for the wonderful session, despite of the small technical issues. So, respected
Uh,
participants, if you have any questions, so you can
you
comment in
can
the
ask.
chat box. Yeah.
Any question, anybody want to ask, you can ask. I want to take to elaborate all those things, but session is very late because because of technical issues. That's why I'm taking it very fastly. Anybody who want to say anything?
Sir, actually, in this Zoho app, they can only express their comments, sir. They cannot unmute and talk, sir. Yes, sir.
Okay, no problem. So again, I want to thank you all, Lavanya madam, Dr. Aparna Parikh madam, and you all team members, those who are organizing this. And because of, I think technical issue is not solved. Again, it is something, maybe
Sir,
it is slowly functioning. Am I audible in continue with the whole session, or it is breaking the sound?
no, sir, you are audible clearly, sir, in the session. Yes, sir.
Okay. Okay. Thank you.
Okay, sir. Thank you all. Thank you so much. So we'll be coming back with a wonderful session by tomorrow. So stay tuned and we'll be back soon. Yeah. Thank you all. Thank you so much.
Okay. Thank you, ma'am. Thanks a lot.
My God.